In the last few decades, the number of people in the U.S. with syphilis has just skyrocketed.
Colorado's health department is now pushing for more testing after a dramatic increase, especially in newborns. Digging into the numbers here, state health officials say there were 7 congenital syphilis cases in 2018, and that number went up to 50 in 2023. This year, there's already been 25 reported cases.
Denver 7's Micah Smith shares the importance of early testing.
TBD, to be determined, a colorful and not so traditional clinic in downtown Denver.
We have built TBD all around making sexual health feel human, approachable.
TBD Health co-founder Stephanie Esty says their goal is to destigmatize sexual health care, including screenings for sexually transmitted infections.
A lot of times STIs aren't emphasized in sex ed. There's so much related to not getting pregnant, but not really the importance of STIs or what some of the implications can be.
Months ago, before state health officials sounded the public alarm, TBD started noticing a major increase in syphilis and other STIs.
It's almost this public health crisis that's bubbling under the surface that no one is really talking about today. We at TBD have seen people coming in with increased syphilis rates. A lot of times people are going months without even being tested.
Colorado's Department of Public Health and Environment recently reported a 7-fold increase in the last 5 years of newborns born with syphilis. This prompted a public health order that encourages healthcare providers to increase syphilis screenings.
So really trying to see an increase in screening occurring at those 3 time points during pregnancy: first trimester, third trimester, and that time of delivery.
State epidemiologist Rachel Herlihy says because some patients may be positive but don't have symptoms, screenings are crucial.
In fact, about 40% of the time when a person is pregnant and their syphilis infection goes untreated, we see that that case is fatal. So we see miscarriages, stillbirths, or death in the baby shortly after birth.
And Esty says TBD wants to help stop this from happening by offering screenings to those who need it.
We do have same day and next day appointments, very similar to an urgent care. We've heard our patients say that is often brought up in other medical spaces. So I actually was very encouraged to see that there is so much emphasis now on syphilis and just greater awareness.
Reporting in Denver, Micah Smith, Denver 7.